Alright. Hi there, my name is Emily and I'm a student physical therapist and I'll be working with you today. My pronouns are she, her. Can you remind me of your preferred name and pronouns?
My name is Julianne and I also use she, her pronouns.
Yes, great, Julianne. So what we're going to do is I'm going to start with basically a muscle assessment, okay, to see kind of what's going on in your body. If something is stiff, if something is short. And so what I'm looking at specifically is your hip flexors, which are the muscles that help you bring your knee to your nose. Okay, so if you don't mind, would you lie down? Oh, never mind. I'm taking it from the top. Let's say you have some back pain and you need assistance.
I would love your assistance.
Fabulous. Alright, so you're in a perfect position on the edge of the table. We do want to be towards the edge with our knee. So I'm going to help you out and let me know if you experience any of your symptoms. Yeah. You doing okay? Yeah. Okay. And then I'm just going to be touching some of your vertebrae in your low back. Is that okay with you? And it would be on your skin. Is that all right? Okay. Just get on here. Because you know we want to find your sweet spot. So you don't want to go too far. You don't want to go not far enough. Spot. So, Julian, if you would hold behind your knee on your left leg, perfect. You can just keep that nice and stable there. And with this leg, I want you to really relax, okay? Just give into gravity. I'll be doing all the work, okay? So, I'm going to be putting my hand on your ASIS, which is kind of the front of your pelvis. Are you okay with that? Finding that bone. Okay, right here. Alright, so right now, I'm just looking for a moment when your pelvis might tilt. That's kind of it. I think that's where we're at. Okay, so based on this test specifically, I would say that your lumbar spine and pelvis is more flexible than your hip flexors, okay, because we had some pelvic movement. But now what I'm going to do is I'm going to stabilize, I'm going to put some pressure into your hip. Is that okay? Alright, let me know if it's too much. Do you, as I'm doing this, do you have any pain or symptoms? No. Perfect. Alright, so we'll keep going. I'm going to push down here, and I'm going to see if there is any hip flexor that is short. Okay. Okay. And Julian, you were able to touch the table, all right, without any additional compensatory movement. I feel like I was able to stabilize you pretty well. So I would say that she doesn't have any shortness in your hip flexors, but they are a little stiff.
Great, thank you so much.
You're welcome. Now we know.
Now we know.
Now we know. If she didn't, if we couldn't go, then we would continue the test and we would go, we would abduct. If she was able to lower further, that would mean her TFL is short. If she was still off the table, we would extend the knee and then see if she could go any further. If so, her rectus femoris is short. If she's still not off the table after those two adjustments, her iliopsoas is short. But Julianne is on the table, so I think that she has no shortness. Thank you.